live. We're testing this out. Let's see what these effects are. This makes my face smooth. Okay. What's this thing? Oh, highlight. Okay. What's this bag thing? Pin to live stream. Pin the products. Okay. Just trying to figure out how this works. All right. Hello. Hello, John. My first time live streaming on YouTube for like the vertical format. Regine, hello, good morning. Pam, okay, we got people coming in. Hello, Chrissy. Good morning. Yeah, I'm just trying this out, Devon. YouTube live stream on my phone in vertical format. Something different. Eliano, hello. Good to see you guys. I know I'm like ahead of schedule here by 2 minutes. I was just so excited. I couldn't wait. Vamp, hello to you as well. Thank you guys for joining. It's been a little while since I've done a live on YouTube in general. The horizontal format, I don't know, it stopped getting pushed out to people. So I heard that this like vertical format does better nowadays. So we'll see. All right, Vicky, jump in with the question. All right, what med should I take if I have hair? If I've had a hair transplant and you're a woman? Well, hello, me. Why? Always good to see you. So for Vicky, well, for women, it's a little bit different when it comes to medications compared to men. Finasteride hasn't really been shown to work very well. So for prevention, usually spironolactone is the way to go. You have to get checked out with your primary care, make sure you can tolerate it, because it is a diuretic and can change potassium levels, so make sure that it's okay and safe for you to take. But that's the one, for women that seems to work best for prevention. And then for like stimulation of the hair and for some additional fullness, consider oral minoxidil, low dose. That usually is what we do in the practice. Other options, you could, add in laser cap. You can add in some PRP treatments, but usually once patients are on one preventative medication, one stimulating medication, I don't really tell them to do a whole lot of other things, especially once you've had a transplant, assuming your hair is stable. But that's what I'd say for women. And then, of course, we do have our thickening shampoo, thickening conditioner that you can check out. That's on the Feel Confident website. And then what I've been talking about in some recent videos, that we're going through a redesign. So we've got these guys coming. So fresh design, fresh packaging with a pump. And I think people are going to like these more from a packaging perspective. They have my name on it. I was convinced to put my name on it. So anyway, but that's the shampoo conditioner that has some good, more natural ingredients in it that could help as an adjunct. Let's see what else. So this is kind of cool. I'm just like scrolling here on my phone, looking at the questions. Everything's a little small, but it's okay. Let's see. So I've recently heard about pigskin breast implants. Are they actually real? How do you feel about them? In general, I'm more of a facial plastics guy, hair, a specialist, right? So the breast implant stuff, I don't really know all the latest. So I'm not sure. I know people are now doing fat transfer to the breast area instead of implants, so that's another thing to look into. Pigskin, I don't really know too much about. Judith says that she saw our ad for the volumizer. It was hysterical. Love your mother's voice. Are those only for men? No, they're not only for men. Our products are for... Sorry, I clicked on something here. Our products are for men and women, right? Both the hair care and the skin care. And we're going to be focusing a lot more on our hair care just to dive deep into that. But they're not meant just for men. So you can go on our feelconfident.com website, check those out. but we've had many women try them and love them. So again, it's not as powerful as the medications, but as an adjunct, I think, they're very well made products. We have a great chemist on board who's actually a family member, really, but has 40 plus years of beauty chemistry experience with big companies, and he freelanced for us. So it's not by chance that we have good products. Chris wants to know, he has a buzz haircut. My hairline is receding. I don't like meds. Can I get a transplant and still keep a buzz cut, or will it be too noticeable? I'm in New York City. So am I, Chris. So my hairline's great. So like the thing is, no one likes the meds. Let me break it to you. Let's be honest here, Chris. No one likes the medications. None of my patients enjoy taking them, but it's very critical to be on them. I just filmed a video yesterday on dutasteride versus finasteride, so that video will be coming soon. And I filmed another one on PP405, which is a new agent that's being investigated for hair regrowth. But anyway, it's just like, it's too uncertain. If you just get hair surgery, you're not on any medications, you don't know which way things will go and how your hair will change. And will the transplant make sense one day if all you do is surgery? Because eventually you run out of grafts, right? There's a limited amount there. So even if you start doing body hair and all this stuff, every source of hair has its limitations. So you really want the medications to lock down what you have, stabilize things, and then use surgery to build on that. So that's what I'd recommend, Chris. And feel free to reach out to us since you're local here. Happy to help. We got, let's see, all bets are off, says thank you for helping others. Well, that's my job. That's what I signed up for. These days I help people with their aesthetics and optimizing that in the ways that I know how, when it comes to mainly hair and lip stuff. So it's a little bit specialized, but we do the things that we do at a very, very high level and deliver real results for people. And I think our galleries these days on our clinical websites, linkovhair.com, cityfacialplastics.com, really speaks to the quality of our work and what we're able to do. So I like having like a very deep sub focus when it comes to clinical practice. I used to do all types of facial plastics, as you guys know, and that was fun and that was great. And now I really subspecialize hair and lip surgery, and everything else I send out to my colleagues. There's wonderful people in New York City. There's wonderful, surgeons around the world, and we don't have to all do everything. I think it's better if we focus in and, do the things that we do on a, internationally top level, top tier. That's my preference, to each his own. Harold says he's listening to me from Monaco. Great fan. Thank you so much. Thank you for following and for watching the material and for learning and for being on today. So appreciate that for all of you guys. Vamp wants to know, do I have a video discussing LPP hair loss? So lichen planopilaris, which is a type of scarring alopecia. I've mentioned it in some videos. I don't have a dedicated video on it. It is kind of like a more narrow topic, but something maybe worth talking about, other forms of hair loss other than the androgenetic type. It's probably a good idea to make a video about that, so I appreciate that. Mark, I know Mark, my YouTube manager, he's on here, so let's jot that down. So basically non-androgenetic forms of hair loss. We should probably make a dedicated video on that. I think that's a good idea. As most of you know, I have an autoimmune type of hair loss, alopecia areata, and I've talked about that one, but maybe a video combining the non-androgenetic types would be nice. All right, will PP still function after PP surgery? Oh, I don't know what they mean by that. Does Viagra or sildenafil affect hair loss? It's not really known to in a consistent way. A lot of medications can have some ill effects on hair, but that's not one that's frequently known to do that. Actually, when patients take finasteride, of course there's a risk that they could have some decreased libido, and some people counteract that by going on Viagra or sildenafil. I don't want patients to have side effects, and so when they have side effects, we drop the dose typically of finasteride, but there are cases where when we drop the dose of finasteride or dutasteride, they continue to lose more hair. So then that doesn't make them happy. So sometimes, trying to find the dose that stabilizes one's hair and then counteracting side effects with a different medication like sildenafil could be effective. That's one way to do it. Judah, thank you so much for trying our facial cleanser. So Michael Genova, the PP405, I've been getting a lot of requests for me to talk about that, for me to give my opinion on that. There was a lot in the news about, did UCLA cure baldness and all this stuff about that. And, it's not like I don't see this stuff, right? So I see it all. It's just that just like I do with all my surgeries, I take my time, I plan, I strategize, I do things properly so that people can get a nice result surgically. And then with my videos, I kind of try to do the same thing. I don't like to just jump in. Sometimes we got to do a quick turnaround, but usually better to take our time, do things right. So the PP405 video is filmed. It's actually on draft 2 now with the editors, and Mark took a look at it recently. So we should be getting it out this week. So please be on the lookout on our channel for the PP405 for hair loss video. In short, I don't think it's going to revolutionize things when it comes to options for hair restoration. That's honestly kind of my opinion, but I delve deep into like the mechanism of PP405. What data do we currently have? What still needs to be done? Also historically, we go back and we talk about the MPCs, the mitochondrial pyruvate carriers, inhibitors, the inhibitors of the mitochondrial pyruvate carrier. And that's what PP405 is. Those carriers have been around for decades. It's just that this one is a little bit more specific to hair. So we'll see. I'm always with these new things, cautiously optimistic, right? When it comes to new medications, new devices, new surgical techniques, I think from a patient's perspective, one needs to be super careful, and we need to investigate this stuff thoroughly and not just jump into the latest craze, right? So that could be fraught with problems. Joy wants to know how to get rid of scars on my face, on my nose, deeper scars. Well, for more fresh scars, you can try our scar gel. You can get that on feelconfident.com. But for like old scars, sometimes surgical revision is possible, or surgical excision of the scar. Sometimes laser resurfacing or chemical peels can be effective. So, see someone, talk to them, see a specialist for this. Sapphire, is it a green or red flag if my septorhinoplasty surgeon is a practicing ENT and a facial plastic surgeon? Well, I don't see why that would be a red flag. Most septorhinoplasties are performed these days by ENTs who are also facial plastic surgeons. That's actually the specialist that you want. That is my background. I just, put down the rhinoplasty scalpel a few years ago so I could focus in on hair and lip surgery. But, that's who you would want to operate on you from a both aesthetic and a functional perspective. Now, we're not all created equal, so you gotta do your research, find someone whose style you like, whose aesthetic you like, but that is the type of specialist that you'd want. Trixie, thank you. Yes, hello. I see you're in the Philippines. That's awesome. One of my lead techs for hair is also from the Philippines. Fat transfer, we usually say, to the face, Vicky. Yeah, it can be great, but it has risks like anything else, right? So, it's a tricky art because only about half of the fat will survive. The rest does not. So, you have to compensate for that, but you don't want to inject too much because then you can get a lot of puffiness. But the nice thing is the fat brings stem cells over, and that can be great, for rejuvenating the skin, not just for bringing in fullness. And sometimes when I use it for like eyebrow, like before an eyebrow transplant, if someone's had like lots of scarring or prior surgeries that didn't quite work, we might do a fat transfer first, and same for the scalp. And actually, we do that with nano fat because we don't need it for volume. We really need it for the more rejuvenating properties. But when it's used to like plump up the face, then it's usually brought over as like micro fat, not necessarily nano fat, because you need the fat cells to also give some volume. So anyway, there's some specifics on fat transfer. Maybe I'll do a video on that too. Mark, let's put that down too, please. Okay, what medicine I will buy? I don't know, that's too vague. Raul, do all patients respond to oral minoxidil 2.5 milligrams, especially paired with oral finasteride 1 milligram? Yeah, for guys, that's the starting dose that I use. Sometimes we'll bump up to 5 milligrams a day if they're tolerating 2.5, but they haven't seen the increased fullness that they were hoping for. For women, we start at half dose, so 1.25. And we see, we always monitor for side effects. We always monitor for efficacy in general. All the stuff, whether most medications are dose dependent, right, for both side effects and for efficacy. So as you go up on the dose, there's potential for more side effects, but also the potential for more, hair growth in the case of minoxidil. And remember, when it comes to seeing hair on other parts of the body, the most common secondary place other than the scalp is going to be the sideburn sort of cheek area here. Lateral cheek is where you could see hair from minoxidil. As you go up to really high dosages, like 10 milligrams a day or more, which is not the most commonly done for hair, you can see more body hair, of course, so just something to be aware of. Michelle, Amy, just say you decide to do forehead Botox. Is this something you have to keep up with? Well, you don't have to keep doing it, but if you want to continue to see the impact of Botox, such as smoothing the wrinkles on the forehead, then of course you have to keep up with it. There is one now, a type of neuromodulator called Daxify that has, it lasts for about 6 months plus. And that's much longer than the other, it's twice as long as the other neuromodulators on the market. So some people are switching to that, but the thing is, if the injection wasn't done to your liking, you might be stuck with a look you don't love for 6 months until the neurotoxin wears off. So you have to keep that in mind. It'll last longer for better or worse. Cut from a different cloth. What are your thoughts on getting scalp massage to promote blood circulation after a hair transplant? Yay or nay, and how often? If you believe in this, and does it work? Well, a lot of things can work, right? But the question is to what extent. So I don't think there's anything bad about, scalp massaging. I think that's fine. There's all these different rollers you can use as well, whether you have a transplant or not. But I just think that the overall efficacy is quite weak. It's not going to rival what oral minoxidil will do. And you don't want to be massaging too soon after a transplant. I would wait at least a few weeks. But yeah, you can do it. I don't think it shouldn't make or break the result. Some of our patients do post-op PRP with us at 3 months, 6 months, 9 months after surgery. And that's meant to start to see the results a little bit sooner. It's meant for overall healing, but it doesn't really make or break the final outcome, right? So just kind of something to keep in mind. Spicy says, what inspired you to go into plastic surgery? Love your videos. Thank you, and thanks to Chrissy. Thank you for watching. Well, I mean, I didn't go into plastic surgery from, high school. It's you go through the different stages. So, first I was I want to be a doctor. I like medical stuff. I like seeing people get better. And that was the driving force, going into medical school. And then I was really interested in art and the senses, and I thought I was going to be an eye doctor for many years. And then I decided, in medical school, I was I really like head and neck surgery, ear, nose, and throat. I didn't know too much about it before trying it out in medical school on a rotation in my 3rd year. Before that, I had very little exposure to it. So other things I considered was general plastic surgery, orthopedic surgery, psychiatry, all those things were neurology were things I at least at some point entertained. And then once I got into ENT head and neck surgery, I was more exposed to some of the cosmetic elements, and like those, I like the reconstructive side of plastic surgery on the face. I thought like the anatomy was awesome. I loved the artistic kind of creativity that came along with it. Then I did a fellowship in facial plastics and reconstruction out at WashU in St. Louis. And that was great. I did a lot of facial trauma work, actually, both in residency and fellowship. Lots of trauma, gunshot wounds, injuries, different fights that people were in, and broken bones and all this kind of stuff on the face. Dealt with a lot of different cancer procedures on the face and all this kind of stuff, like super interesting. But I kind of wanted to have my own practice, and then in fellowship I got introduced to hair surgery, which before that I knew very little about hair. And as you guys may have seen on the internet and in my old videos, I had a full head of hair, back then, and now I got this, right? So it's life happens, and I have an autoimmune hair loss condition, so lost all my hair in 2020. And then I was like getting more and more into hair surgery, and decided actually to pretty much exclusively do hair surgery. I thought, I really enjoyed it, and I liked the emotional kind of connection to it once I started to experience my own hair loss. So that was interesting. And then the lip stuff I was already doing a lot of, the lip surgery, so I didn't want to let that go. So that's pretty much why my practice is what it is today. And I think one good question is, do I miss some of the surgeries I no longer do on a regular basis, like rhinoplasty and facelifts? And the short answer is no, I don't, because I'm very busy doing the things that I'm doing, and patients are very happy. We do things high quality, take good care of our patients, and that seems to work well. And then now, we're still making videos, trying to get the good word out, trying to educate. We're going through this rebranding, as I mentioned earlier. So taking it from our classic bottle shampoo that we've had now for over a year, and just went through a big rebranding. So this will be nice, a nice pump that's coming in the fall. So, I'm really excited to bring more products, especially for hair care to the world. But we're starting local in the States, and I think we ship now just to like Canada, UK. So we'll see. But all that's been fun. Adarix, hey doc, had an FUE 5 days ago with over 5,700 grafts, and my donor area is burning like crazy. What do you recommend for elevating the pain? I think you probably meant eliminating the pain. Well, first of all, it's always best to talk to your surgeon, who did the case, to see what they would recommend for you, because they know your case best. In general, the donor area can sometimes give a little bit of a burning, some nerve sensitivity. You got to make sure first off that there isn't anything dangerous going on. That's a whole lot of grafts, buddy. That's a whole lot of grafts. God bless the clinics doing 5,700 grafts a day. I'm not a fan of that. We generally, most guys have about 6,000 to 8,000 grafts to give over a lifetime. So burning through the majority of those grafts for one session, where you don't, listen, you always have to hedge a little bit. You never really know what's going to happen, right? What if a tech had a bad day that was on the team that did your case? What if you have an accident after the surgery where you lose a bunch of grafts? Like, it's just, it's kind of tricky. It's kind of like, I think like throwing a Hail Mary to do cases of that size. I know people are pushing the boundaries. There's like an arms race. They're competing on how many grafts they can do in a day or in a 2-day span. It's not a competition, my friends. It's not a competition. It's about getting people good, high quality results that are going to be with them for the rest of their life. So doing that in a few portioned sessions, in my opinion, is better than doing something as heroic as almost 6,000 grafts in a day. But Adarix, as far as pain goes, you have to be careful very soon after surgery, because if you're taking things like Motrin, Advil, Tylenol, and this goes Motrin, Advil, Aleve, anything other than Tylenol as an NSAID, you could increase the bleeding. You're 5 days out, so you should be pretty good from a bleeding perspective. So you might consider that. But again, I can't. This is not to give you medical advice, right? It's kind of illegal for me to do that here. So for specific cases, you have to ask your surgeon, right? Like I would want my patients, especially 5 days after surgery, to feel like they can trust me, to reach out. I give them my cell phone number. And that again is just kind of speaking to like quality, quality care. There's quality care on the actual like technical surgical side. And then there's just taking good care of patients and being there for them. And I think all that's important. And I think as we've started to kind of commoditize plastic surgery, a lot of that seems to be kind of lost or falls by the wayside a little bit too much, in my opinion. Evelina, do you have any contacts with doctors in Europe that perform upper bleph? I've got severe hollow eye bags. Well, hollow eye bags usually also implies that you might benefit from lower bleph, not just upper bleph. But I don't have anyone specific. You just have to kind of do your homework and see who's out there. I'm sure there's someone in your area who does quality work, so seek them out. Nick, why would a dermatologist prescribe me minoxidil for androgenetic alopecia and not mention finasteride? Well, Nick, that's all too common. And I have a video, maybe Mark could share here, on why I hate topical minoxidil. And that is one of the things I talk about there. All too often people go to see a doctor and they're well-intentioned, but they don't really understand hair loss and how these different medications work. So, they give you something that has maybe a better side effect profile, which is minoxidil compared to finasteride, but it's doing a completely different thing. It's not protecting your existing hair. It's temporarily giving you slight increased fullness, but ultimately it is a losing battle as far as hair loss. So got to be on finasteride, my man, if you want to protect your hair. I mean, if you don't care about it, let it go. But if you want to protect it, that is important. I wish there was something else that would substitute for that equally as well, but there really isn't. And then as far as dutasteride goes, which is the slightly stronger version of finasteride, I just filmed that video, like I mentioned earlier, yesterday. So we should have it out in maybe, 1 to 2 weeks. So once we have that, you can kind of watch it to learn about the differences between those two. Nils, what are the scientific results of Botox in the scalp? How often, and also the results of stem cells from fat placed into the follicles? People are always looking for these new things, and let's just stick to the tried and true. And until I see something new that is actually performing better than the tried and true, I will continue going with what has been working for decades for people. In my practice is 7 years old, right? So I've been seeing my own patients in a private practice for 7 years. And then other people have been seeing patients for decades for hair loss and prescribing the same medications. And we know they work. We know how they work. We know the drawbacks. We know how to modulate them. These new things like Botox in the scalp are still not totally proven. They are not giving some radical results that are so impressive. Same goes for stem cells. Stem cells are very tricky. They're, first of all, can be dangerous. Depends on the source of the stem cells. Exosomes are a little safer because it's just like the extracellular vesicles. It's a little closer to PRP. But remember, exosomes is coming from an exogenous source. It's not from your own body. We have started offering exosomes with PRP in my practice over the last 3-4 months, and it's going fine. Again, that's not revolutionizing results, and neither is our stem cells or anything else. There's lots of new things, right? There's like the machines like Alma TED, which is more ultrasound energy for the scalp to infuse things. There are laser devices now from like Luminous. They make a system called the Folix. These things are just okay. I mean, I haven't, again, seen any super impressive results with them, and I feel like we get better results long-term with minoxidil and finasteride than I've seen in other people's clinics from all these other things that exist. So, tried and true first, first line medications. And then if you want to boost things even more and you don't want surgery, or you had surgery and now you're looking for something else, then you can look into laser light. I usually like the Capilla system. You can look into, PRP at an office, with or without exosomes. Botox, I think, is even less proven. Stem cells as well. So, don't just jump on the latest thing. Go with what we know works well first. Asylum, 2 months post rhinoplasty and my lips and philtrum are really weird and worse. Is it permanent? Is it possible to improve this with the revision since I don't like the nose either? Well, 2 months is way too early. No one's going to do a revision rhinoplasty for you, or no one good is going to do one for you until at least a year has passed. Give it time, see how it heals. Don't jump too early to conclusions. Of course, there's ways to modify things down the road with the revision, but give it some time. 2 months is early. Michelle Amy, hello from Australia. Hilda, hello. Thank you for joining. Prince, finally found you live. Love from India. Thank you. I was watching all your videos about male pattern baldness. I'm 20. What should I do? Like I'm having receding hairline. I'm using 5% minoxidil. Prince, finasteride, not the minoxidil. You need finasteride if you're losing hair. That is really what it's for. So watch my videos on minoxidil, watch the videos on finasteride, understand how the medications work, what they're used for. And what else do we have? Watching from North Sentinel Island, very nice, thank you. Major breakthroughs in the coming years. Ooh, that's a loaded question. I think I have a video about the future of plastic surgery, so maybe Mark can link that here. Does smoking cannabis accelerate androgenetic alopecia or interfere with finasteride minoxidil treatment efficacy? No, not that I know of. Before hair transplant surgery, we do have patients cut off their cannabis intake, as well as honestly minoxidil, because we want to reduce bleeding during surgery. So things like cannabis, minoxidil can actually thin the blood. So we ask people for at least like 10 days before surgery to just not do that, so that we reduce the amount of bleeding during surgery. And the bleeding, it's like I can get through the surgery if there's a lot of bleeding. The problem is visibility. So it's not so much that you're going to lose so much blood. It's really just that, like, if it's interfering with my ability to see, then the results, they're still going to be accurate because it's me and I'm very careful. I'd rather take, much longer to do the case right than rush through, and if there's bleeding and not seeing and potentially risk having a worse result, right? You're not going to see that in my clinic, but, it still can interfere with visibility, so that's not great. R1234 is asking, does blepharoplasty lower the eyebrows as they lose the support they were standing on? Not necessarily, but it can hollow out your upper lids. So just keep that in mind. It can give a more aged appearance that way. So you never want too much skin removed. And then also you might have trouble closing your eyes. So that's also equally bad. So, it's all about that, finding that balance, right? Not too much, not too little. Crunchy Frog, Dr. Gary, love your channel. When is there ever going to be a simple solution to sagging neck problems? I use the Feel Confident hair products. These bad boys. Thank you, Crunchy Frog, for using them. And I hope that you will support us with the redesign, which look like this. So these are coming in the fall. So that's exciting. No, I don't think there's ever going to be a simple solution because, the tissues, as they sag, there's no easy way to lift them. All these non-surgical things like the radial frequency microneedling, Elacore, microcoring, all that stuff is just not that impressive, and it makes surgery much more challenging to do. So usually when the time is right, doing a proper facelift, neck lift, usually just makes the most sense for sagging skin that's sagging neck that's bothering you, if it bothers you. How to wash hair 6 days after a transplant? Can the patient touch the transplanted hair? Yeah, Juan, so at 6 days, actually, when we we'll allow our patients or encourage our patients to do their first scalp shower. Like you can body wash, the day after surgery, but in terms of like standing under the current in the shower with your head, that happens on day 6, and at that point you're basically lathering over the area with usually still baby shampoo to work out the crusts. So that's typically what we recommend, and we have a video on post-op hair transplant care. So Mark, if you can link that, that'd be great. All right, Papers planning a chin implant. Good luck. Is there any way to get rid of excess skin without invasive surgery? No great way, honestly. Lost again. Chopsticks. You're the only person I've seen who looks better without hair. Oh, thank you. Vinu, doctor prescribed dutasteride for my hair loss. Haven't yet started because of the side effects. How long will this remain in the body after stopping? So I just did a video on this yesterday. So it's not released yet, but I filmed it yesterday. So the half-life of dutasteride is 5 weeks. So it takes 5 weeks for the medication in your system to get cut in half. So it does stick around for a while in the system, right, for months. Something to consider. But we don't start patients on dutasteride, male patients. We start them on finasteride for their hair loss prevention. But if it's not enough, and after 3-4 months go by and they're still losing hair, then we might bump up to dutasteride. But it is stronger. It does have more side effect potential, but it is more powerful. All right, let's keep going. Nikhil, I was experiencing hair fall, dry hair, scalp. Please tell me medications to control. I was thinking to use better shampoos and oils. Well, for shampoo, as far as, like optimizing your hair, not so much from like a dryness, scaliness perspective. For that, I like Nizoral or really ketoconazole is the active ingredient there. But for the rest of hair needs, we have it at feelconfident.com, so pick up our shampoo. But as far as like your hair fall, you really ought to be on, again, known proper preventative medications. So if you're a guy, finasteride or dutasteride. For women, usually spironolactone. Do you like soap, saw palmetto? Because every shampoo has a little bit, especially, yeah, right. Our shampoo has saw palmetto, it has pumpkin seed oil, it has curcumin, it has caffeine, it has these active ingredients that help with reducing DHT, they're anti-inflammatory, right? So that's the complex, and we've actually named our complex on the redesign, you'll see it, but Root Defense is our trademarked complex of ingredients that have been studied and have been shown to work the best. So that's why we put those into the products. Frankie, oh yeah, supplemental, yeah, okay. Suede, Dr. Linkov, I had a botched facelift in South America. Can you help me? Well, I no longer perform facelifts. That's not the focus of my practice these days, but definitely there are people who do revision work and should be able to help you. Just look for a revision facelift specialist. Let's see. Daniel wants to know why some experienced surgeons prefer using linear implanting fashion instead of scattered method. Is it a bad sign? Well, if you're talking about the hairline, or really I guess anywhere else on the scalp, kind of doing these lines, that's not how hair exists in like actuality, right? So I think the best way to create natural results is to mimic what exists in nature. So like if it existed in nature as lines of hair, then I would do that surgically, but that's not the case, right? So having more scattered patterns like you're mentioning here is the more natural way to go. It's a little easier to just create lines of hair, but you don't want it to be easier for your surgeon, right? You want them to do things the right way. So pick a place that you can trust. SD guy goes, I feel more comfortable going to an American doctor like you than the 6K trip to Turkey. Listen, to each his own. I try not to criticize anyone's decisions. And whatever, whatever it is, it's like I'm busy enough. Turkey, many clinics there are busy enough with patients, some of whom come from New York, where I live and work. They go to Turkey, and that's fine. Everyone's got their budget, everyone's got their vision for what they want, and I don't really judge people on their decisions. Karan wants to know, are there any bad consequences of starting on finasteride for a year and stopping it for 1 to 2 months and then again resuming? No. If you have enough of that medication in your system for a year and then you stop for 2 months, you're unlikely going to see too much of hair fall in those 2 months, and then you can resume. People do that often for family planning. So if they're trying to conceive, the general recommendation is to come off the medication for a few months, and then you can resume it, once pregnancy is confirmed. What else, guys? What else? Come on, let's keep going. I'm gonna skip down to the bottom. Lizzie Pop, some Turkish doctors out here stealing kidneys. I don't know. I mean, maybe, but I think majority of them are not doing that. Ahmed wants to know, could we see you make a video with Derek, more plates, more dates soon? I would love to. I've interacted with him on Instagram before, just through DMs, but this was a few years back. Now I think maybe he feels like he's gotten too big for me. I don't know. But yeah, I know he has a podcast. If he invited me, I'd go on, but no one's extended the invitation yet. So we shall see. But you guys can write to him and suggest it if you really want to see me on his podcast. American Girl, my son started losing his hair drastically at 20 years old, now 28, been on finasteride and Rogaine, at times looks better, then some days not. Any suggestions? Well, sometimes we have to bump people up to the stronger version of 5-alpha reductase inhibitor. So sometimes we go from finasteride to dutasteride. So be on the lookout for that video that I just filmed yesterday. It's going to come out maybe next week, maybe the week after that. But that video talks about when to bump up to that stronger form of hair loss prevention. So your son maybe could benefit from that. But, again, you can reach out to the clinic. For medical therapy guidance, my PA, Christina, usually takes those consults. When it's more surgically related, then I get involved, of course. But yeah, that's what I'd recommend for like personalized attention and personalized recommendation. Earthy Artist, Dr. Link, hi doctor, question, fat transfer into upper cheeks has sagged over time, looks bad now, what can be done to fix it? Well, you can sometimes get like a little lipo, but lipo on the face is not like in vogue. You can cause different problems like skin irregularities with that. So honestly, sometimes a good facelift to kind of reposition the fat into its more natural kind of architecture is typically the best way to go. So if you've never had a facelift, or it's been a while, that you might consider doing that, and that will hopefully help with the sagging. All right. Scander, is it normal to experience hair loss when using finasteride? Again, kind of same thing I mentioned earlier, where sometimes we do bump people up to dutasteride. Do you recommend PRP for intimate areas? That's not my forte. I don't do that. We do sometimes, rarely do hair transplants for pubic areas, but that's not common, and that's a very specific ask. Skincare line, again, we have an amazing chemist, Shelby. He's been in the beauty chemistry world for over 40 years and has worked for some of the biggest companies and freelanced for us. So we put a lot of thought and effort and, really picked out ingredients that were, very high-end ingredients for our skincare line as well as hair care. Any truth to red onion juice and hair growth applied topically? No, there's no good evidence for that, but feel free to try. Neon. Some doctors steal kidneys, but Dr. Gary steals hearts. That's cute. Thank you. Lex Luthor. Okay, yeah, sure. Thanks, King Lee. Do you recommend shaping hair to grow stronger? I don't know. I guess. Sure. Dutasteride, long-term effects on kidney and liver. I mean, nothing that's been shown to be so harmful at a standard dose. Delivery costs the UK of our products. Yeah, eventually, as we're in more places with our warehouse, the delivery costs will drop. But we got to get bigger first before we can start to ship to 1 million warehouses around the world with our products. Feel confident products for acne. Not really. Our products are not meant specifically for acne. Someone sent money for a super chat. No, we don't really need the money for that, so I appreciate it, but no need to send more money like that. If you can't swallow capsules, can you split dutasteride capsules and drink the liquid? I think so. I think you can. It should be fine. Hi, Dr. Gary. I've been using minoxidil for more than 2 months and having a little bit of a prickly hair on my hairline. There are not many, so this is a good sign? Yeah, I mean, if you're happy to see the prickly hair, sure. If you're not happy with it, then that's not a good sign. But yeah, it sounds like it's doing something. Coco, thank you. Yeah, my wife is the best. That's true. She is the best. All right, let's keep going here. Someone who hasn't asked a question, let's jump down. Okay, protect the doctor. Thank you, Vinu. Appreciate it. Have you done a video on the shedding of hair while using minoxidil? Yeah, I've definitely talked about it, and we have like dedicated minoxidil videos. Just put in minoxidil Linkov on YouTube in search bar, and you'll see them. Jay Singh really wants to get his question answered, so let's answer Jay Singh. I have not seen your question. Jay Singh, put your question in. I don't know where this super chat thing is. I'm on this vertical format for the first time, so bear with me and just put the question in the chat, and I'll answer it. I don't see your question. I keep seeing you referencing your super chat though. All right. Mark, do you see Jay's question? Jay Singh, where you at? All right. I still don't see it. Jay Singh got mad and just left. Meanwhile, I'm out here looking for his question. All right. Sorry, Jay. Is accepting the hair loss better financially and mentally in the long run? Rec Ethics wants to know, or is it better to take prevention as early as possible since I'm still under 30? This is a personal decision. You know what I mean? People ask me sometimes, like, why don't I do more for my hair? I mean, I can take a very strong immunosuppressive because of my autoimmune condition. Maybe that will help my hair, but I don't really want to be stuck on an immunosuppressive medication that is not critical for my life. That is my personal decision. Everyone gets to make a decision for themselves. You know what I mean? So, but like when I first got my autoimmune condition, I had very brittle nails, and that would drive me crazy, and it gave me nail pain, and that was going to make surgery a little harder to do. So if I still had that problem, which now my nails are strong, thank God, but if I still had that issue, I probably would take the medication. You know what I mean? So everyone makes decisions for themselves. I'm not here to tell you to do anything for your hair to make it better. I mean, if you're fine with how it looks, then just leave it alone. I'm just here to help the people who want to do something about it, or want to know what are the downsides of doing something. You know, some people watch my videos and they decide not to do anything, no surgery. You know, I scare them with some of these complications, risks. I'm about to film a video today on facelift risks and complications. Listen, I just think people need to be informed, and then they can make whatever decisions make sense for them. Oh, here's Jay Singh. Is oral minoxidil safe long-term, despite studies being only 24 weeks long with no long-term data? Well, I mean, I can tell you from clinical experience, it's not just me prescribing oral minoxidil. I have colleagues who've been at this for much longer prescribing oral minoxidil. At low dosages, it tends to be very safe. Some people for hair loss are or for hair boosting are prescribing upwards of like 10 milligrams a day, I think at that dosage, you start to potentially run into real problems. So I don't go up that high, but at a low dose, we haven't really had any issues. The maybe 1% max that experiences some palpitations or a little lightheadedness, we drop them to half of the dose that they were on, and then those side effects tend to go away. So that's been the clinical experience for me, Jay. Hopefully that's helpful. Robin, all right. I've been buying oral minoxidil from Feel Confident, but I'm pretty sure my resting heart rate has risen by at least 10 beats per minute. Is this a known side effect? Yes, it can be related. Definitely talk to your primary care doctor, but you might have to cut that dose in half, or you might have to go back to like a topical formulation if it's not working for you. But talk to your primary care just to make sure. What else? What else? What else? Someone, Tin wants to know what would be good for diffuse alopecia due to lupus. Well, sometimes scalp micropigmentation is a good option, or like a hair piece. If there's no transplant option, then those are two other things to consider, like a wig essentially, or scalp micropigmentation, which is like little small dots of ink that might help kind of mask the lighter scalp from the darker hair, makes it a little bit more fuller looking, basically. Let's see, what else? Jay, he's back with another one. All right, no long-term data. Okay, Jay is concerned about the long-term side effects of minoxidil. Haven't seen them, but yeah, who knows? Who knows? Maybe if you're taking it for 50 years, maybe it'll present a problem, or maybe not. So I think it's worth monitoring and seeing, but we don't know of the exact 50-year out complications of oral minoxidil. But at a low dose, so far it's been fine. Daniel wants to know topical finasteride, 0.005%. That's very low dose. Might be an option for someone who experienced side effects even from the lowest oral dose. Well, the standard topical dose is usually 0.25 or 0.3% finasteride. So going down to 0.005, I'm not really sure how effective that will be. Your side effects might be gone, but it might not do anything for your hair. So usually once the low dose oral form was exhausted as an option, we go down to 0.3% topical. Ahmed, he's afraid to lose grafts 8 days after transplant. Usually, you've lost grafts in the first few days. You experience some bright red blood coming from those areas if a graft comes out. Otherwise, you just have to kind of give it time and see what your final result was. DUPA. Can DUPA be treated? Diffuse unpatterned alopecia is what DUPA is. Can it be treated? Yeah, you can try to treat it, sure, with minoxidil finasteride. The results won't be as impressive as if you don't have DUPA, but it can definitely be attempted for that as well. It's just that surgery becomes a little trickier on patients, with DUPA. Okay, I'm a nurse getting ready to start an injecting program soon. Super excited. Good luck, Lindsay. Good luck. It just takes practice, especially to stay safe. It's all about being safe. What's with these deleted messages? I'm considering a transplant. Can I do both the crown and the front in one session? That's a good question. Well, generally speaking, it depends on what each area needs as far as the dosage of grafts, meaning the number of grafts. With all other things being equal, like if you're in a clinic that knows what they're doing artistically and also with the survival of your grafts, of course it comes down to numbers. So we tend to do one area at a time. Sometimes I'll combine the front with the crown if there's a smaller need for each area. If I can get away with, say, 1,200 to 1,500 grafts in one area, and then the other area doesn't need a whole lot more, and we can split the procedures into about 12, 13, 1,400 into each in one surgery and have that make sense, then great. But if the crown is this big and totally bald, I mean, it needs a lot of grafts to make an impressive change. So in that case, like sometimes we'll focus there first, or if the front is really thin, we might focus just on the front first, right? So just depends on the clinical scenario. Couple more minutes, guys. As a doctor, how do you prevent career burnout? The Bebop wants to know. Well, first of all, you have to do what you like and take some breaks from the routine. That helps. And I don't know, just have a good team around you, good people, supportive family, supportive colleagues, staff that can help, that like take some pressure off of the doctor. I think that helps. That helps a lot. American Girl, do you offer financial assistance for hair transplant? Well, we have like financing that people do. That's the kind of the extent of that. You can always reach out to us to find out what those options are. What else, guys? Thank you, Kuba Conrad. My poor son has the worst receding hairline at 17. When hair loss starts that young, it's going to really most likely end up in a more of like a Norwood 6-7 pattern. So being on the proper preventative medication is really important if he's looking to preserve what he has left. It will make his eventual transplant results much more impressive than if he loses the rest of it and then has to do a transplant. All right. Oral or foam minoxidil for hair breakage during perimenopause. I mean, oral minoxidil is just going to be more effective, so usually that one. What else, guys? A couple more minutes. What percentage do you consider a good graft survival rate when it comes to hair transplants? Generally 95% plus Nawaf. That's kind of the standard these days to do it properly. Everybody, Kay wants to know, better to start finasteride before minoxidil. Oftentimes patients are starting them together. They're doing two different things. So they're kind of like complementary to one another, but they're not the same thing. They're doing two different things. They work well together. I tried ketoconazole, coal tar, selenium, sulfide, all these shampoos, but dandruff still won't go away. Please help. Do I need an oral medication? Yeah, sometimes you need a topical steroid. That is sometimes what patients need, or the ketoconazole percentage maybe is too weak for you. So the prescription types go up to like 2% plus. The over-the-counter is 1%. Sometimes that's the best next thing. Candy wants to know how to get these meds. Well, some of them we have available at feelconfident.com. And if you don't see, a medication that's available there that you're interested in for hair, reach out to us, to the clinic. Our contact information, we're very easy to find. Just like Google search my name, Gary Linkov, or on our YouTube, you can search in the bio. It's very easy to find our clinic and how to reach us. And we do video consults, we do in-person consults, whatever people need. Doctor, what needle size do you recommend for microneedling temple area for regrow miniaturized hair? I'm not a huge fan these days of microneedling at home. We have a recent video on that. Maybe Mark can link to that in this chat. But basically, depth-wise, you're looking at usually 0.5 millimeters is sufficient. Some people go up to 1 millimeter, 1.5 millimeter, but it's like a delicate balance because as you get deeper, your risk of scarring will increase. And that scarring can actually lead to some hair loss over time. So that's why it's a little bit tricky. Temporarily it can give you the appearance of some more hair, but over time you can actually have bigger problems. Ellie wants to know how I split my time between operations, educating. yourself on new discoveries and content creation? Well, part of content creation for me is educating myself on new discoveries, right? Like the PP405 we were talking about. In order to make a video on it, I had to do a deep dive into like what it is, how it works, what's the actual data say. So that's kind of the benefit of doing content creation as opposed to just like only doing surgery. I operate Tuesday through Friday, and weekends are for family, friends, some like paperwork as well, and like preparation for videos. And then Mondays, which is today, is my day for some meetings, some things like this, some content creation. I do some video consults on some Mondays as well. And yeah, so that's more or less kind of how I split my time. 2 minutes left. Okay. What else, guys? Roxy says, Jeff Benzo question, though. I don't know what that is. Had a hair transplant. I have dandruff. I'm not sure. What do you recommend? A week ago, that's very recent. Definitely talk to your hair surgeon with any immediate post-op questions. No, the SF, the excessive hair growth on the body from oral minoxidil, usually will have has the main priority is the scalp, because that's where the hair is most often in the anagen phase. That's why it has like a propensity to help with scalp hair the most. The second most common area where you can see hair growth from oral minoxidil is going to be the sideburn, lateral cheek area. So for some women that might bother them. Guys usually don't care, but for women they might consider like laser hair removal in that area. As you go up to like higher doses of oral minoxidil, like closer to 10 milligrams, yeah, you might see it in other parts of the body, but usually at low dosages we don't really see that. Does going to the gym affect hair loss, especially as it increases testosterone? It can. Usually not in any super significant way, but the thing is that a lot of people who go to the gym regularly, they take a lot of these supplements like creatine, like other supplements. And we know that, there's a large percentage of supplements over the counter that are laced with anabolic steroidal compounds. They don't tell you about this, but that's partly why people go back and buy more of those supplements. So it's almost advantageous to those companies to lace their supplements, right? So that's the thing. And then those types of supplements, those types of chemicals can convert more over to DHT and can lead to further hair loss. So the need for finasteride and for basically, anything in that category like dutasteride is going to be higher if someone is on, say, testosterone replacement therapy, or they're working out a lot and taking all these supplements. We definitely see a correlation with additional hair loss, and then the need for the prevention goes up. Guys, thank you so much. It's been like an hour. This is awesome. Hopefully we'll do more of these. Yeah, check out, again, feelconfident.com. It's where we have our products. These are all very carefully formulated with a lot of care and attention. These are not white labeled garbage. This is like the real deal. So we are conducting some clinical studies on our own products, and that will be coming out in the fall along with the new bottles with the pump. So I'm very excited. It's also like a really nice soft feel to it. So just a higher quality of material here. So anyway, check those out, feelconfident.com. Thank you so much. If you have questions that are clinical, specific to your case, and you want us to take a look, just reach out. Our email is info@cityfp.com. Maybe Mark can add that in. info at city, CITYFP, like Frank Peter.com, or facial plastics in my case. If you want to see our gallery, we have our lip stuff is in a gallery on cityfacialplastics.com. Our hair work, it's easier to search for it on linkovhair.com. So check it out. See you guys soon. Thank you for watching. Thanks for participating. Bye.